U.S. President Joe Biden has announced on Monday that his administration has to do more to provide COVID-19 testing, as the number of cases nationwide surges due to the Omicron variant. Biden made these comments during a virtual meeting with state governors on Monday. The Biden administration has faced criticism for a shortage in the availability of rapid coronavirus tests. Biden has announced that his administration will be purchasing 500 million rapid at-home tests, which he said will be sent to the American people for free for those who request it. To ensure equitable access to free at-home tests for all uninsured and underserved communities, the president will double the commitment to distribute free tests to community sites to 50 million from 25 million tests, and will add rural clinics to the program. Partnerships with trusted community providers will aid in getting these important testing supplies into the homes of hardest-hit communities.
We went from no over-the-counter tests in January to 46 million in October, 100 million in November, and almost 200 million in December. But it's not enough. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. Because steps we have to take to increase the number of authorized tests, we're now able to purchase 500 million at-home rapid tests to be sent to the American people for free when they request it. And we're going to continue to use the Defense Production Act to produce as many tests as possible. And starting in 2 weeks, private insurance will reimburse you for the cost of at-home tests. We're providing access to free tests for folks who don't have insurance. But we have to do more. We have to do better, and we will. We've already deployed emergency response teams in Colorado, Michigan, Minnesota, Vermont, New Hampshire, and New Mexico. Things are better, but we do know that with the rising cases, we still have tens of millions of unvaccinated people, and we're seeing hospitalizations rise. It means our hospitals in some places are going to get overrun, but in terms of equipment, both in terms of equipment and staff. That's why we stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We're mobilizing an additional 1,000 military doctors and nurses and medics to help staff hospitals. FEMA is deploying hundreds of ambulances and EMS crews to transport patients. We've already deployed emergency response teams in Colorado, Michigan, Minnesota, Vermont, New Hampshire, and New Mexico. We're ready to provide more hospital beds as well. The bottom line is we want to assure the American people that we're prepared. We know what it takes. And as this group of bipartisan governors has shown, we're going to get through it by working together.
President Joe Biden has said that he would support an effort to shorten COVID-19 quarantine requirements for those who test positive if U.S. health authorities recommend such a change. U.S. health authorities have currently recommended a 10-day quarantine period for most Americans who test positive for COVID-19. But last week, healthcare workers who contract the virus have been able to return to work after 7 days of isolation.